I just give a recap since we haven't.
All right, we were muted. Well, um, we are having a relatively off-schedule meeting to talk mostly about authorizing the purchase of an ambulance today. And Trustee Valentin is going to take us through the details.
All right, so let me just give you guys a quick overview, okay? So there's a couple of pieces that are in this presentation and a couple that aren't that are relevant. So I'll go ahead and get started. I know that in something that's relevant information for this, but that's not literally tied to the presentation. Part of the reason why we're moving in this direction is obviously our population growth, right? As you guys are aware, our service area is fairly distant from existing hospital services. And the transportation time is longer than it is in other parts of the county. And we, across our community, don't have the number of ambulances that we need to be able to effectively serve our entire. That's going to continue to grow. We're going to continue to grow, and it's going to continue to be an issue that gets exacerbated. Ed and I have been going through an exercise over the last couple of weeks, and I'll share that with the board, especially member Tate had asked questions about that in the past. And we started putting pen to paper or typewriting to Excel spreadsheet about the number of units and the anticipated population growth since we took over in the position. And excluding about 6 or 7 developments that we know are coming, but that haven't been finalized, et cetera, or that we don't have confirmation about design plans or anything of the sort. We're anticipating over 2,000 new units already being developed, and a population, those units would lead to a population increase of about 6,500 or so residents from where we were in 2020. If my memory serves me right, it was about 29% population increase from those developments that are in the works, or at some point in the adoption process. That's a very significant increase in the number of runs that we're going to be seeing as well, beyond what we've already seen. So it's just something to be aware of as why we're growing. I know that the board recognizes that, and we've had this conversation quite a bit, but just figured that I'd give you that overview. So I know that it's been a relatively short time to be able to get you everything. So I wanted to go through the proposed timeline. We're anticipating what we're trying to do here is in November and December, or this November to December for this year, purchasing the ambulance, going and entering into an agreement for the billing process with MetBill. That's one of the major providers for the billing services for ambulances. It's also the service that T's and other ambulance services in the community also use as well. In addition to that, Chief Huff is going to be working towards finalizing our ALS certification process, as well as working towards us being able to have a DEA license. The DEA license isn't required for us to be an ALS provider. We have to be working towards it. So we would be able to start that process and the ALS before that DEA license is finalized.
What is the DEA license specific? It requires you to purchase your narcotics. So right now, the ambulance services and everybody are using their medical directors, which is what we would do.
Yeah.
The DEA is cracking down more to other individual places have.
Yeah. And how long would that take?
First step is to get the state pharmacy board to approve, which is we're working on our storage plan and all of those things right now. They don't require, it's anywhere between 3 to 12 months, depending on the DEA schedule. But they are not, like I said, as the trustee said, it's not a requirement right now. As long as you're just working for it. The state knows it's coming, but there's not a drop dead July 1st. You must have your own DEA number. They anticipate 26, 27, 28, but who knows? And with a new election, so.
In addition to that, then in Q1, we would be able to begin operating as a BLS ambulance. Again, BLS being basic life support services. And then in Q2, as we concluded over email, their hope is to be able to accelerate the hiring of the board shift suppression firefighter to April instead of July. We're doing calculation based up on our leftover surplus revenue that we will have at the end of the year. That we know that we'll be able before that, but still, it'll be something that gets approved next year, not right now, once we have the final numbers for what our budgetary, cycle was for 2024. And then, we would also be looking and working towards the local income tax council request, which obviously, as we've outlined, does not require them to provide it. We have reason to believe that between the public hearing and the slight turnover in the county council as a result of this election, that we'll have really high chance of being successful in our request.
So what's the anticipated income if this is passed?
So we will be requesting, there's a couple ways of measuring that. My understanding, and it's not anything that's been finalized, it depends on who applies for it. There's a couple of ways that it could be played out. We could get anywhere from $200,000 to $500,000, depending on what the process looks like, what the final process that gets outlined and approved by the different communities is. I honestly couldn't give you a specific number, but we think that we will be able.
You mean revenue from the ambulance itself?
No.
From the public safety.
From the council.
Okay.
Yeah, so that's the 200 to 500 range-ish, so.
And
But we're operating in a world where we don't need that tax.
Yes.
It would just be nice
Yeah.
to fill the.
Yes.
so that's not, that'd be nice to have,
But it's not, we know that we can make it work without that. Having that money allows us to have an even better cushion for the.
and how long does it take to apply and when would this be done?
So it would be, so if we receive funding, this will happen by, the deadline is, if I remember correctly, they have to approve a resolution before September 1st of 2025, and then we would start receiving the disbursements in January 26th. And it would be a monthly disbursement, same as local income tax. So that would be what that would look like. And then in part, depending on the discussion about the local income tax, whether that has been approved by the council, but also what our revenue looks like as a result of the ambulance service, then we can evaluate accelerating the addition of a fifth firefighter. That would allow us then to be operational 24/7 as an ambulance service, as an ALS ambulance service, at the latest by Q1 of 2026.
But that Q1 of 2025, where it says basic life BLS ambulance, we will still have paramedics that will be here to be able to work as a paramedic on that ambulance. So
Yeah, so help me understand the difference. Is this a difference in equipment? Is it a difference in staffing?
yes,
So-
skills that things that can be done.
And
So
also billing. So what you are able to bill for from a BLS versus an ALS call is different, but also the quality of care that the patient, the more important part, the quality of care that the patient's receiving in a BLS truck versus an ALS truck.
Yeah, so we can't do ALS until we can guarantee every time it goes out, it's gonna have a certain set of skills on board. As well
we
as
can't classify the ambulance as an ALS as an ALS ambulance until we have a paramedic that's staffing that ambulance all the time.
Okay.
When we do BLS ambulance and we have a medic chase, let's say today, Andrew's a medic on duty today. So what would happen is the ambulance would still roll out of here. Andrew would chase that in the pickup as the paramedic. He would then climb on that truck. So, and ride in that truck as essentially a chase medic right away.
And we would be able to, at that point, correct me if I'm wrong, bill that as an ALS.
So we currently don't have anybody that's here hired that can operate this.
Yeah, we do.
Yeah, they do it for.
Well, we do, but we don't have somebody that can do it full time.
Yes,
As
So
fire.
that's why you're wanting to accelerate that, I was wondering if we.
Yeah.
So I know just, so I can understand this process. Let's say the ambulance rolls out. They pick up somebody, deliver them to Franciscan IURNet. How is that billing process then done?
So it'll be, from our perspective, it'll be fairly hands-off. It'll be, We will submit, the run report to Metville, well, through ESO, through our reporting software. Then we will submit that to Metville. Metville will bill the patient. Metville will collect the money and then we will receive the money. Is that a correct understanding?
Yeah.
Roughly speaking.
Yes.
So it would be fairly, offhand from the perspective of the trustee's office. It would be very similar to what they already do, having to do a run report. They're just, would be a little bit more specific and detailed.
And that
based on-
depends upon the insurance, right?
Yes, there would be different reimbursement rates, et cetera, depending on whether it's Medicaid, Medicare, VA, or it's private insurance, uninsured,
And is there a percentage of people who pay and don't pay?
yes.
Yes, that'll be,
That's kind of
again,
built into our estimates. Yeah,
yeah, it's, again, all of that stuff is hands off for us. Once we set this up with Medville, we are out of that. We're aware of what their estimated return rate is for billing and things like that. We will meet with them. They will give us that based on demographics and, AE stuff in the county. There's a lot of things they take into account for what they estimate it would be. And
That's
then
what all these numbers that are anticipating that some kind of probability statistical table showing income.
yes, and it was very conservative numbers that we used.
yes.
So,
Thank you.
And then, so let's go on to the ambulance purchase itself. Just a quick note, the number will be a little different than what we talked about because in our initial estimation, we were anticipating to have to pay for the striping and everything separate from the purchase. But with this ambulance, it'll actually be included into the purchase price, so we don't have, it's a little higher, but it's because we're getting that done by the seller.
so truck will come to us complete, ready to go versus us having to take it over and get
From
them
the rover outfit or so. Just a quick note, because that'll be a different number than last time. But we have looked, like we discussed, at a couple different options, F-550 Super Duties or an international chassis. The difference in anticipated lifespan being 5 years versus 7+ years, depending on run volume. We anticipate that we would be assuming that we are responding to the hospitals on the Lafayette side in the future where something happens that would shorten our drive time, of course. But assuming that it's the hospitals on the Lafayette side, it would be about 5 to 7 years, depending on the two chassis. And we would anticipate that we're putting between 25 to 30,000 miles on those trucks on a yearly basis, just based on our anticipated run volume of roughly about 1,000 calls when we're up and running both as a BLS and ALS truck. And then we had looked at the possibility of an ambulance box, whether it be a new ambulance box that just got built for us or a remount. And then also we were looking at a power load system, whether it be new or refurbished. Our recommendation from the fire department and myself would be to go with the international chassis, the remount box with the new power load system. So that's the one that we shared figures for. And again, the estimated cost with the paint and everything, the striping and everything would be $403,000. And then this is an example of the recommended ambulance. This is a 2022 from Goshen Fire Department. So it'll be a very similar looking ambulance in the sense of the apparatus itself. And so going on to the financial impact, I know that we've kind of gone through that. Our cumulative fire fund, we were currently anticipating to end the year at about 768,000 in the bank. The purchase of the ambulance with the 403, but 12,000 of it coming from existing appropriations would leave our balance at 377,000 for the end of the year. On our operational side, we have been looking, and again, some of these numbers are from the email thread as well. The accelerated hiring of that fourth firefighter that got approved earlier this year, that would put us, that would cost us about $75,000 to move it 1 quarter forward. And we anticipate having over $104,000 left over in the personnel line items in the firefighting fund at the end of the year. And then for 2025, and I think that this part of this has been like discussed here shortly, we're assuming only BLS income, so we wouldn't be able to, we're assuming we can single run in the year as an ALS truck, which is not what would be the case. Because we would have that chase medic that's jumping on the truck and we would be able to bill at a higher rate and collect more revenue from those. We would anticipate having about $341,000 over the course of the 12 months operational. And then have operating expenses if you're running a full year of $92,000. And we would want to save about $75,000 of the revenue towards the future replacement of the ambulance. That would leave us a net revenue of $174,000, which we could decide to use again to bring in that fifth firefighter and that paramedic earlier. So the cost would be about $75,000 to add one of that position, like the fifth firefighter on a shift, doing it for 1 quarter, about $75,000. Doing a paramedic instead of a fifth firefighter, $75,000. If you did both of those, $150,000. So, and this is again the conservative estimate of ongoing anticipated revenues and expenses. So looking at BLS, ALS, income and mileage, we would be talking about a total of $765,000 in revenue. And then our expenses between med bill, the staffing gap between what the 1111 fund can fund and where we're going to be at, the ambulance replacement savings being set aside, the medical supplies, the paying the medical director, fuel, maintenance, etc. We would anticipate having expenses of about $669 from that revenue, which would leave us about $95,000 in annual surplus going forward, assuming again that we don't do 3-year appeals, etc., which are part of what we're looking to do in the future. So again, assuming none of that takes place, we would have about $95,000 of annual surplus from where we're at from it.
So let me understand why ongoing, we're gonna have 341 from BLS income, which is what we're estimating that we're gonna get this year. And then we're also gonna get 324 from ALS.
Because this year, what we have about 1,000, we anticipate having roughly 1,000 calls. Let me pull up the breakdown here. Apologize. It was rough. So our breakdown is, we anticipate having a total of 581 BLS calls per year and a total of 413 ALS calls per year. And we're assuming that anytime in the next year that we have an ALS call, we're not the agency responding to it. So we assume all of those runs were being taken care of by another ambulance provider. So again, very, very conservative numbers. Because we're saying we're not taking that call. And that's gonna come to be the one that does it, which is not the real number that will be in again. Does that answer your question?
Yeah. So, and what are we basing that on? Is that, do we have current calls that come in for Ts that get dispatched that we're basing that number on?
Yeah, so all of our medical runs, yeah, all of our current calls.
Okay.
So it's based on our current calls, and then just because of the way that ambulances work, we're estimating that on a yearly basis, we'll take 75 ALS calls outside of our service area and 75 BLS calls outside of our service area, which is again a conservative estimate of the number of calls.
Actually, when you do the ALS, BLS breakdown, it's a pretty standard trend across the country on how that breaks down. So we just, again, took some conservative numbers based on what our run volume was and kind of broke it down from there. Of course, working on the ambulance, you get a little different perspective of some of those things. And I mean, Dan and I for sure, and I know with Andrew being a new medic, for sure we're kind of over ALSers. We probably provide more, there will be more probably advanced life support calls than a service like T's that's got a very short transport. Our time being up here, that transport time to the hospital creates more time for kind of more things to do. You know, if Dan takes a run on Creasy Lane, the amount of time he has to get from that house to the hospital is a very short window of time. So the ability to provide other services, they're just, it's kind of especially right now, given that we've not run an ambulance, they're conservative estimate numbers just based on the run volume that we have and what we've seen at this point.
You say that it's a conservative estimate, but you know, you also talk about a 29% increase. I mean, that's a huge increase. Wouldn't that warrant
Yeah.
less conservative numbers, or you're gonna try and nail down the expenses?
So the expenses are gonna be relatively flat, like the cost of the medical director is gonna be flat. The med bill number for example, is gonna increase with revenue. So like that's a percentage of the total stuff collected, that'll be what it is. So like if we get 100 more calls and we collect, let's say, $1,000 more or something like that, then we would be just throwing a round number out there. Then they would take a negotiated percentage off of that and the
I
3 to
guess,
6.
what I hope, when are we expecting that increase?
Throughout
to
the,
occur? Like, is it, I mean, is this gradual, or is this like a,
Gradual.
by this date, by this year? You know,
The increase in,
the
in the
population.
population, you said at least 2,000 new units.
Yeah.
About 6,500 more, you know.
some of those units that are.
Some of them have happened.
Some are completed.
Okay.
Some are in groundbreaking, some properties sold, they're starting to move some ground, they're kind of in all different areas. We had to kind of sit down and figure this out across for many reasons, not just this, to try to get an idea of where we were headed, and that's just all the developments that we're aware of that are coming, some that they're getting ready to break ground on, haven't done anything yet,
So
so.
like there's developments in a couple different stages. So in this
Yeah.
year, for example, this last 6 months, we had the Paramount the Wabash Loft apartment
Wabash Township and the Oasis.
and the
Across the
Oasis.
street.
Got the vibe just finished off of Paramount as well.
Yeah.
There.
And so those are either coming online or have recently come online. We have developments here coming, the townhomes that are in the building process and will be online within the next year.
But you've already taken that and figured that into your numbers. That's what I want to make sure.
Well,
Cause it sounded like you guys thought about it and then you made a guesstimate, but before you got the number, so I wanted to make sure you guys.
yeah, so we did
taking
it.
that into account.
So we did a very conservative estimate, in the sense of like what our revenue is gonna be. So like some of that stuff, like we wouldn't, although it would require folks to be going on more runs, when we have more staffing, then we wouldn't necessarily need to, like if we had 100 more runs a year, we wouldn't need to have like an extra staffer or something like that, right? Like there's still capacity to be able to run that ambulance. So that's our biggest expense, which is the personnel.
You've heard conservative numbers many times, said this, right?
Yes.
So we believe that the numbers that we gave, I intentionally, as we were trying to work through some of these numbers, tried to give a much lower number than what I anticipated it to be, just for this reason. I would rather have a worst case scenario. And you know, when we started talking about ALS non-transport, just doing that alone, we were okay if we broke even, right? Like it's not a money-making venture for this process, but at some point it's going to have to move that way. Because eventually we're gonna burn our medics out enough that we've got to be able to add more people, so we have to. So this whole move here, and of course I sent you guys a message about it, but this whole move came as a result of us and Dan really invested a ton of time in getting us to that place anyway, to where we could do that. And then that step to what we've all been working on anyway with this ambulance process was a much closer step than we thought it was going to be. So, you know, as we're working through that anyway, we've got to get the equipment anyway, we have to get the supplies and all the meds and all those things anyway. Dan just politely said, so why don't we just get an ambulance and throw the stuff in there, right? Like we kind of. So it was just if we're already here and we're already doing the service, we versus a project that we're entering with somebody else that we would receive maybe reimbursement, some pieces of it. This way we're getting 100% of those calls, not a fraction of it had they agreed to that. So if we're running those calls anyway with the same number of people, I mean, right now, if a medical call goes out, there's 3 guys on shift, 2 of them are sitting here. They're going to, 2 of them will leave here on the truck, right? So it would essentially be the same thing. The problem is that turnaround. So trying to get there and back. So it was a very close step to move towards it being a revenue generating process from it being a break-even process. If that makes sense.
Got a death notice.
Death notice.
I vote aye.
I heard it.
We'll have a forum anyway.
Yeah. You guys have any other questions or anything? I know that it's,
No, I'm okay.
I know that we're dropping a lot of figures and numbers at you guys, which.
I like the word conservative.
Yes. Yeah, like frankly, and you know, I think that that's been generally, I know, I'd rather, like, when it comes to something so big, I wouldn't wanna press forward with a high range of, you know, of error being against us, so instead I'd rather.
That was
be-
all my questions were, and I feel they were answered well, so I'm fine.
Okay.
Make sure if it goes pear-shaped, we're not screwed. So,
Oh, for sure.
that's the whole.
For sure. And I think that truthfully for me is the beauty of this process. We have the ability right now, especially while we're doing BLS and then we have a medic that's chasing, we have the ability, if this isn't working like we want it to just stop running that truck right now until we get it figured out. Once we're ALS non-transport or ALS transport, that we're getting a waiver from the state. There are requirements on that truck being in service 24 hours a day, 7 days a week. So then we have to, if that's not working, we've got to go through a whole separate process to pull the truck out of service. So this gives us that ability to start the process, work through the bugs of the process. There will be some, no matter what we try to do, there will be some. Figuring out those relationships with our surrounding agencies and all of those things, and be able to move the process forward in a way that it works for our staff, it works for our billing process, the trustee's office. This is that baby step, I guess, through this process. So, and I know it sounds like I'm trying to sell it. I'm trying to sell myself as much as you guys. So,
Yeah, you gotta do the work.
hear me out, right?
And just to highlight there, again, from my perspective, and short of seeing like actual numbers, right? So we would have to be hitting good numbers on the revenue and everything for me to feel comfortable on the fourth quarter, unless we would have been approved for the public safety tax dollars, in which case that makes the implementation have a little bit more wiggle room as we go, and to be able to develop it without, not that we anticipate again dropping into negative revenue, but that we would feel even more comfortable that would allow us to be able to implement that without having any negative impact whatsoever on financing, so.
And I will probably be the guy to say something I should be saying offline, online, but I'm gonna say it anyway. When we look at public safety tax, right, as we've applied for that for our communication equipment and things like that, we've had to make that choice, right? Our choice is, can we stretch this equipment, make it work? The advantage for us right now, the state's not flipping the switch yet, like they told us they were going to. That's something we can push. But a public safety tax request for an ambulance that will likely respond to a lot of areas that's not just right here, to me is a much easier appeal, right? Because that's a very simple thing for folks that don't know what we do. When we ask for communications equipment, it's just another piece of equipment for us. Everyone knows the use of an ambulance, what it's for, what the value is. So I think that helps us to make that delivery for that process.
And again, just turnover in the council, we feel fairly confident that it's direction that we'll be able to get support with the county as well. And like we mentioned before, West Lafayette has already had buy-in, so it's about finalizing what process still through. At least from my perspective.
Got any questions?
No question. All right, we are still going to apply for another saving. I didn't hear if
Oh,
you
yeah.
talked about that or not, so.
I think we've talked about it before.
Yeah,
I mean. Okay, I will call for a vote on resolution 2024-24. To authorize an ambulance purchase for up to $405,000.
And that includes, just to make sure that includes the power load system, which will be purchased separately, then shipped to the vendor and they will install it. And the installation cost is included in that.
Yep.
In that number.
Do I have a second?
Second.
All in favor? Aye. Yes. All right. Next meeting is December 17th. We'll take care of a bunch of fairly boring business, but we will see you then. If there's any announcements, we can do that.
Just, I know that I've mentioned it before, reminder that I'm out on vacation from November 16th to December 1st. I will be back.
and if any of you like chili, we're doing a chili cook-off here Sunday, but I'm gonna win again. Welcome to come and check that out.
Only reason you want last year is because I didn't bring any.
Oh, no, when are you on vacation?
16th to November 16th.
All right, move to adjourn. Thanks, guys.
Second.
Appreciate you. All in favor?
Aye.
Aye.